In this video, I'm going to go over what a heart attack or what a cardiac arrest is, the causes of it, symptoms, and what you can do if you or someone else is experiencing one. So first of all, what is it? So as the name suggests, a heart attack affects the heart muscle, which is the muscle that pumps blood throughout the body. And it's due to a lack of blood flow to the heart, which correlates in like a lack of oxygen supplied to the heart. And that prevents the heart from doing what it's supposed to do, which is pumping blood. And this causes tissue death that worsens over time. So the causes. The main cause of a heart attack is an artery blockage, specifically a blockage in the coronary arteries, which are the arteries that send oxygen to the heart muscle. And when there's a blockage in these arteries, it prevents blood flow and it prevents oxygen from being delivered to the heart muscles or the heart tissue. And artery blockages can happen due to a plaque buildup. So plaque buildup are basically cholesterol deposits kind of building up in the arteries, and that basically clogs up the blood flow and causes blood clots to form. So on the diagram to the right, you can see here's like a plaque buildup here. And as the plaque buildup gets bigger and bigger, it prevents blood flow from smoothly, flowing through this artery. And over time, a blood clot forms. And once that forms, I can see it completely seals up this artery and prevents any blood flow from going through. And this whole process I just mentioned, there's a name for it. It's called CDH, or coronary heart disease, and it's the leading cause of heart attacks. So symptoms. Symptoms of a heart attack may differ for men and women, but common symptoms are pressure or squeezing in the chest, lightheaded or out of breath, and chest pains. So, and women may have additional or different symptoms, which are upper abdomen or back pain, nausea and vomiting, and fatigue. And it's important to note that if any of these symptoms last more than 10 to 15 minutes, then always seek medical help, whether that be for you or someone else. And symptoms may show hours in advance. So it's important to act on these symptoms to prevent major damage or major harm. So that leads into the next point of what to do. So call 911 immediately. So don't ignore or hope for the best. So once you recognize these symptoms, either for yourself or for someone else, then seek help immediately. Do not wait or do not delay. And for some reason, if you can't get if you can't get an ambulance to your location, then drive to the hospital. But only do this as a last resort. Usually the best way is to just call 911 and wait for the ambulance to arrive. And something you can take or administer to someone else is aspirin. And what aspirin does is reduces tissue death and prevents blood clotting, which can buy you extra time while you're waiting for the ambulance or if you're driving them to the hospital. However, it is important to do not take aspirin if you're allergic, if you have a stomach ulcer or ulcer, if you had a recent stroke, or if you have high blood pressure. If you're administering aspirin for someone else, it's important to ask them if they have any of these conditions, as if you take aspirin, if you have any of these conditions, it could just make your condition worse. And if you're with a person and they stop breathing and go unconscious, it's important to do CPR immediately. And a quick run through of what CPR is and how to do it. It's basically 30 chest compressions per 2 breaths. That's the ratio you want to maintain. And you want to do it at a rate of 100 to 120 compressions per minute. And that may be a bit hard to wrap your head around. So that's basically doing chest compressions to the beat of the song Staying Alive. And if you have an AED nearby, then it's important to use that as well. And follow the instructions and placement guide that should be available on the AED. Thank you for listening. If you have any questions or concerns, feel free to leave them in the comments below. I'll try my best to answer them. And thank you.